Dr. Murray here again with a tip on how to stretch your hips. This is something I commonly give patients when I see an imbalance right to left. So what I mean by that is if you have your two hips, these are the hip sockets, our hips should be able to rotate inward and rotate outward. So if you stand up and you try to turn your legs in so that your toes are touching each other, that's internal rotation. And then if you try to turn so that your toes are outward, that's external rotation. A lot of times what I see is that a patient will have great external rotation on one side with just not very much internal rotation, while the other side they can internally rotate all the way, but they can't externally rotate. So this is just a common pattern that I'm seeing with people. It's just another imbalance. And for the intermediate fitness patient, higher level fitness patient who doesn't have a lot of hip pathology going on, I tend to give them what I've just called the mermaid stretch, kind of stealing a little bit from Stop Pilates and some of those positions. But yeah, I call this the mermaid stretch. So basically you have one leg that's externally rotated, and then you have the other side internally rotated. And what you want to do, I'll see a lot of patients will sit like this because they can't even get in, or they'll lean back. So eventually you want to be able to sit up nice and tall. This is down. Your opposite bottom is reaching down to the floor. And if you're already there and you feel pretty good, you can take your arm up, side bend over, and then you can stretch what's commonly also tight, the QL. And you'll also feel it in the IT band, which we know now connects to the TFL that connects to the IT band. And if you've watched some of the previous videos, you know that the IT band causes a lot of knee pain. So another way to stretch the IT band proximally. And then I have patients switch to see if the other side is easier or harder. Same thing, over. And I would say hold for about 30 seconds and see which one's tighter, and maybe hold that one a little longer and see how you feel. Give it a try.